Now, we talked about how high-dose vitamin C is actually something that is going to keep disease cells at bay, all right? Which is why we can use it as a support for clients who actually have active cancer. Okay? It's going to help allow the body to take traditional therapies like chemo and radiation, and it's going to help them tolerate these better. Okay? So how is that possible? Chemo and radiation are pro-oxidative therapies. Guess what else is? High-dose IV vitamin C. It's also pro-oxidative. So that means it's going to work with chemo and radiation, and it's going to help allow these to work better, allow their function in the body to actually work better, and allow you to have better tolerance of these things. It's going to help with energy. It's going to help with the negative effects that you get from chemo and radiation. So it is something that completely works in conjunction with chemo and radiation to support people in active cancer therapies. So it's extremely important and extremely beneficial to people who have active cancer. The most important thing, though, is that we're doing this correctly. So we're going to do lab draws and make sure that somebody doesn't have a G6PD deficiency. We're going to do therapeutic doses of 25 to 100 grams depending on each client's blood levels. Okay? So we're going to get into the realm of the true therapeutic dosing of high-dose vitamin C, which we do through a very controlled and easy-to-follow protocol. At those doses of 25 grams to 100 grams, remember, high-dose vitamin C becomes pro-oxidative, which is why we can give it with chemo and radiation to support those therapies. Anything less than 10 grams, right, which is your traditional Myers cocktail, your traditional infusion that we even give at Michigan Immune Defense, they're going to be less than 10 grams of vitamin C, which will make them function in the body as an antioxidant. All right? We don't want to give low doses of vitamin C or antioxidant doses of vitamin C to clients who are currently receiving chemo and radiation, because these are pro-oxidative, right? So if I give an antioxidant to a pro-oxidative therapy, it's going to combat the effects of that therapy. So this is why we absolutely don't want to give antioxidants during chemo and radiation, because it's going to negatively affect their effectiveness. All right? Instead, we don't give antioxidants. We give pro-oxidative doses of vitamin C, which is the same as pro-oxidative like chemo and radiation, so they all work together synergistically, okay, inside the body to have benefits, positive benefits to the cells and negative benefits to cancer cells.